Okay, so today my title is Role of Ocular Blood Flow in Deep Layer of Optical Head in Glaucoma. So this is my financial disclosure. Today, my topics included the relationship between deep layer tissue blood flow in optic nerve head and lamina cribrosa thickness. And the second part was talking about the deep circulation with peripapillary atrophy, PPA zone, and associated factors. So glaucoma is multifactorial disease, and many risk factors listed below are reported for glaucoma pathogenesis. So complex combination of different risk factors causes visual field defect. And a mechanism-based approach to drug discovery is needed to prevent blindness in glaucoma patient. Today, I'm talking about the abnormality in lamina cribrosa and the relationship of the ocular blood flow. So these topics was already published. The abnormality of lamina cribrosa in glaucoma patient, lamina defect, and deeper depths of lamina cribrosa surface, and higher curvature of lamina cribrosa surface. So both lamina cribrosa depth and lamina cribrosa deformation are associated with glaucoma presence. So this slide shows the relationship between lamina cribrosa and glaucoma risk factors. Three major risk factors is ocular hypertension, and disc hemorrhage and myopia is important risk factor for glaucoma, especially in myopia related to normal tension glaucoma. And ocular hypertension deepens the lamina cribrosa surface, like this here. And disc hemorrhage is co-localized with lamina cribrosa defect in whole foods progression of visual field loss is rapid. And myopia induces temporal tilted the lamina cribrosa surface, and lamina cribrosa tilted toward the inferior side is related to glaucoma. So lamina cribrosa is associated with glaucoma risk factors and primary site of glaucoma pathogenesis. And this slide shows the change of lowering ocular blood flow in glaucoma patient. Blue Mountain Eye studies show that the thinning of central retinal artery in normal patient is a risk factor for the presence of glaucoma. And our data showing laser spectrography, that's measuring the ocular blood flow machine, measured tissue blood flow in optic nerve head is significantly lower in peripatetic glaucoma. It's very early time point glaucoma stages. So this is a laser spectrography images in optic nerve. We can measure the tissue blood flow like this. This is quantitative data we found even in peripatetic glaucoma, already decreasing the ocular blood flow like this. So tissue blood flow in optic nerve head, it decreased significantly in early stage of glaucoma. So this slide shows the meta-analysis data predicting a prognosis factor for glaucomatous visual field loss. And we found many blood flow related factors listed in this, especially normal tension glaucoma. So lowering blood flow is a prognosis factor for progressive visual field loss in normal tension glaucoma. So we want to know the relationship between the lamina cribrosa thickness and blood flow. We have to set up a new model to segment it out, the lamina cribrosa with ISSOCT. And first identify the center of the BMO with reconstructed image, ISSOCT volume data image in optic nerve head. And then we superimpose 646 grid and measure the lamina cribrosa thickness in each grid after making the superior and inferior border of lamina cribrosa. So definition of lamina cribrosa we use here is a visible area of lamina cribrosa pore. So this is the result. We found lamina cribrosa thickness also significant decreasing in PPZ and also OAG, further decreasing OAG. So here we included 100 cases of OAG. And this is the B-scan, and the lamina cribrosa thickness was significantly lower in glaucoma. And multi-regression analysis show that larger cup disc ratio and lower MD and lowering blood flow was significantly and independently correlated thickness of lamina cribrosa. So the averaging lamina cribrosa thickness decreased with glaucoma stages. tissue blood flow was independently correlated to laminar cribrosa thickness, thinning. This short summary. Ocular blood flow is deeply involved in the glaucoma pathogenesis and successfully developed a new simplified version of software for measuring the laminar cribrosa thickness with ISSOCT. And the laminar cribrosa thickness was independently correlated with tissue blood flow in optic nerve head. So I move to the second topic, deep circulation with PPA zone and associated factors. So this figure shows that anatomy of ocular blood flow in optic nerve head. And there are two major sources. One source is SPC, short posterior ciliary artery, and another source is central retinal artery, CRA. And the surface of nerve fiber layer is supported by branch of CRA. And anterior laminar cribrosa and laminar cribrosa part and the posterior laminar cribrosa part was also mainly supported the branch of SPCA and circular of Chin-Harder here. And interestingly, the SPC supported also peripapillary choroid, and so this part is already published, important part of glaucoma pathogenesis. So we are interested in this part to measure the blood flow with SSOCT angiography. Recently, the OCT angiography clearly showed that the Korean clip already published that this is a choroid layer, and we found in peripapillary atrophy zone, we detected the microvasculature dropout area, and this is often associated with glaucoma presence. So OCT measured MVD in PPA zone is almost identical perfusion defect in the cyanin green angiography. So we performed the research, and we included 105 eyes of 105 NTG patients with myopic disc, because myopic disc is more easy to recognize the MBD in PPA zone, and 20H matched control with myopic disc. And definition of myopic disc was used for Nicolelis classification and temporal tilted of disc and the presence of PPA. So the main outcome measurement is we use peripapillary macular bundle ganglion cell complex here, average to here, and also tissue blood flow measured by laser spectroscopy, and PPSCI in choroidal intensity measured by OCT-A angiography. And we use central as shown in central 4-point of Humphrey field analyzer. So this is the result to compare the characterism of myopic NTG patient and glaucoma-free myopic control. So we found there is no difference between age and sex and visual acuity in these two groups. However, the temporal tissue blood flow was significantly lower, and visual function and OCT central structure also decreased in myopic disc NTG patient. So myopic NTG patient had lower temporal disc tissue blood flow and PPSCI. And this slide showed to investigate the factors relationship between PPSCI and central visual function. And interestingly, as I already told you, that PPSCI and temporal blood flow was mainly supported same branch of SPCA. So these two parameters were significantly correlated in our groups. And PPSCI was significantly related with temporal blood flow and a parameter of central visual function, including structure and function also associated with PPSCI. And this is the multivariant analysis revealed that PMV structure and central visual function was a significantly contributor to circulation of deep PPA layers, and also age, higher age and lower pulse rate, and longer action lengths, and larger PPA area was associated with lowering PPACI. So this slide shows the hypothesis to show that impaired deep PPS circulation as a potential risk factor for central visual field defect in myopic glaucoma. So as I told you that this temporal tissue blood flow and PPSCI was mainly supported the SPCA. And in the formation of myopia must stretch out of this part. Maybe this part influence the microcirculation in adjacent temporal optic nerve head, but thereby contributing to the decreasing axoplasmic flow and resulting in central visual field defect. So this is summary 2. Decrease in PPSCI was associated with reduced laser spectrography measured temporal tissue blood flow and with deterioration of both central retinal structure and visual function in eye with NTG and myopic disc. And this is conclusion. Impaired deep circulation in temporal branches of SPCA, both inside, measured by laser spectrography, and outside, measured by OCT angiography, with ISSOCT measured angiography, that may induce glaucoma changes in lamina cribrosa central visual functions. Thank you very much for your attention.